this lesson, I'm going to explain the uses of the Leopold's maneuver and how this is going to be incorporated into practice. So what is this maneuver and why do we do it? So it is the palpation of the mom's abdomen or the uterus. And the reason why we're doing this is we're palpating to find what the presenting part is one reason why we do it. So are we head down? Or what is down? And then the fetal heart rate monitor, so we know where to place it. So it's best to hear the fetal heart rate on the fetal back. So if we can know where the fetal back lies, then we can better place that heart rate monitor to pick up good heart tones. Let's look at the maneuvers. So there are 4 different maneuvers that are done. First is the fundal grip that you see here. So our fundal grip. So if you see this nurse here or physician is pressing on the top of that uterus at the fundus and feeling what they feel there. If there is a head, it is going to feel hard and be movable. So if it is a bottom, then it will feel harder and irregular. Okay, so the fetal butt is also going to be firm, but it's going to be irregular. The next grip here is that umbilical grip. So you see here, she's or he is grabbing on either side, and that's the umbilical grip. So with this umbilical grip, we're feeling, what do we feel on the sides? So it should feel some irregular bumps. And those irregular bumps are going to be, fingers, toes, knees. So these are just the bumps that are felt. Then next we have the pelvic grip. So the first pelvic grip here, let me put first because there's 2 different ones. So our first pelvic grip, this is done by facing the mother. So you can see this person's facing the mother, and you are going to press into the pelvis to see what that presenting part is and if it's engaged. And remember, if it's the head, it's going to feel hard and be movable. If it was the butt, then it's going to be firm but irregular feeling. And then our second pelvic grip is going to be standing at the head of the mother and down into the upper pelvis. And this is going to determine if it is the head down. So you would only do this one if the head was down. If the head is flexed or extended. Now, these are very hard maneuvers to kind of get down. So it just takes practice feeling, the different grips to see what you're feeling. Our management for this patient is really just to make sure she's lying back and she's comfortable. There's a lot of pushing going on, which can get uncomfortable. So we really want to make sure that she has an empty bladder because all that pushing on is not going to feel so great. And then explain what we're doing. We're feeling for the presenting part and the best location to assess those fetal heart tones. Comfort and reproduction will be our nursing concepts for Leopold's maneuver. We got to keep the patient comfortable during this, and obviously she has reproduced. All right, let's review our key points here. So the Leopold's maneuver, this is an assessment that we're doing. So we're trying to find the fetal back for fetal heart tones. The reason why this is the best spot is because think about it. If the baby's in fetal position and all curled up, it's not like you can get a monitor on the heart, right? So the fetal back will pick up our heart tones the best. And then we are also assessing for the presenting part. So what is down? Hopefully the head. And then let's look at these. So we have our fundal maneuver. We're feeling at the top of the uterus, the fundus. The umbilical maneuver, that is the sides. And the first pelvic we have where we're facing mom, and that's for the presenting part. And then when we stand at the maternal head for the second pelvic maneuver, we're feeling if that head is flexed or extended, of course, only if the head is down. And then what are we feeling? So if it is a firm, movable ball, it is the head. If it's firm and irregular, it's the butt. If we feel small bumps, it's things like the fists, the knees, the elbows, and toes. Make sure you check out the resources attached to this lesson. Find a friend and practice the different maneuvers as well as reviewing what each part feels like. Now go out and be your best selves today. And as always, happy nursing.